A brief report. Late improvement in consciousness after post-traumatic vegetative state by Childs and Mercer. This article was published in the New England Journal of Medicine on January 4, 1996. An 18-year-old woman suffered a traumatic brain injury in a motor vehicle accident. A CT scan showed blood in the third ventricle and generalized cerebral edema, which is accumulation of excess water in the intracellular and/or extracellular areas of the brain. Her score on the Glasgow Coma Scale and the duration of her coma are unfortunately unknown. It is only known that she awoke from the coma to a vegetative state and remained in that state until transferred to the care of the authors of our paper 4 months after the traumatic injury. The Glasgow Coma Scale is commonly used to assess the level of consciousness and subsequently the severity of brain damage. The patient is evaluated against the criteria of the scale and given a score between 3, which is the lowest score and denotes deep coma or death, and 15, which is the highest score and denotes a fully awake person. This allows the severity of brain damage to be better evaluated and a more accurate diagnosis to be reached. While for the patient in this paper, her score on the Glasgow Coma Scale is unknown, one can assume it was rather low, probably between 3 and 10. At that time, 4 months after the injury, neurologic examination of the patient showed spontaneous eye-opening but no visual fixation or tracking. External stimulation caused nonverbal auditory responses and increased flexion of muscles. She was incapable of speech or voluntary movement and was unable to respond to commands. CT scans taken at that time showed widespread cerebral and cerebellar atrophy. 15 months later, the patient was reported to have moved her leg and blinked her eyes in response to commands, but inconsistently and rarely over a 2-month period. In an attempt to improve responsiveness, a drug regimen of bromocriptine and dextroamphetamine was started at 16 and 17 months respectively. Her responses became more consistent in response to the drug treatments. She became able to follow simple commands within her motor capabilities and could complete simple tasks such as arithmetic and multiple choice problems using eye blinks. 2 years after the injury, bilateral somatosensory and visual responses were evoked on a regular basis, and 3 years after, she was able to communicate using eye blinks for yes and no, and she inconsistently accepted oral feedings. 5 years after the injury, she could communicate by mouthing words and phrases. It was said that she was usually in a good mood also. She had a 15-minute attention span and was able to sustain on simple oral feedings. She was wheelchair-bound and dependent for all care. However, she did have some side effects due to the injury, such as hypertension, sinusitis, and deep venous thrombosis. 5.2 years after her injury, she was sent to live at home with her mother and released from the long-term care facility. There is only one other well-documented case of late improvement after permanent post-traumatic vegetative state. As you may recall, vegetative state is considered permanent and irreversible after 12 months of the injury. The Multi-Society Task Force on Persistent Vegetative State empirically estimated the risk of prognostic error as 1.6%. There are 7 cases of known recovery after 12 months. Most patients who have some recovery show improvement within the 1-year mark. This patient is remarkable, as improvement did not start until 15 months after the injury. Here are some questions for discussion.